सर आ गए क्या रोहित?
हाँ जी, आ गए मैडम।
गुड मॉर्निंग सर। क्या कर रहे हैं सर आप आज फिर मिरर के आगे?
I have got little tongue bite today.
Okay.
There's ulcer. I was checking my occlusion.
Okay.
Is there any sharp? I found there is sharpness here.
Okay.
So I often get the lip bite, cheek bite, and tongue bite. So there is a need. Okay, some sharpness should be removed.
तो ये कैसे होती है सर चिक बाइट लिप बाइट? किस प्रॉब्लम से?
You know the teeth do not remain in isolation. I told you, it has to remain in harmony with other structure. They don't function in isolation. They have to function in harmony with the TMJ, with the tongue, with cheek, and with the lip
Okay.
and other muscles. Okay, if there is a sharpness, any high point, then a discrepancy, and it will create a unstable occlusion, and there will be disharmony. There will be lip bite, cheek bite, plunger cut, food impaction. There will be pain in the TMJ. There will be strain on the masticatory muscles. So it will be a very problematic.
हाई पॉइंट से इतनी प्रॉब्लम्स होती हैं सर?
I myself, I got the ulcer today.
ओके.
And so, if there is a need, it must be checked.
हाँ मैंने देखा है सर पेशेंट जब भी आते हैं उनके ट्रीटमेंट के दौरान या ट्रीटमेंट के बाद आप हाई पॉइंट पे बहुत ही जोर देते हैं.
There is a need because I found the occlusal adjustment have got its own role. People say it's so controversial, but it's a 50 years long treatment procedure. It's a practical, logical, and it's very relevant. Provided you examine the that prematurity in time and do it effectively, selectively in select patients. Okay, if you do haphazardly, irrationally, illogically, then it becomes irrelevant. That is why I attempt to check the occlusal arrangement during treatment, before treatment, after treatment, because it is an adjunctive therapy.
Okay.
In the temporomandibular disharmony problems, and it is a complementary treatment for comprehensive prosthodontic restoration, and it has got a prophylactic
ओके सर.
in periodontal patients. So it is a supplementary in the orthodontic also. So post ortho also we need to check the orthodontic stability. If the orthodontic stability is not there, then it will relapse. So after endodontic procedure also the tooth become fragile. So prophylactically we reduce the occlusion. So whenever patient comes with the lip bite, cheek bite, or some TMJ problem, there is a need to do the thorough examination and find out the culprit, occlusal prematurity. Okay, then only we can do a satisfactory treatment. That's why I was today myself had that.
आज सर हाई पॉइंट पे चर्चा करते हैं. आप इसके बारे में मुझे कुछ और भी बताइए. और आप ये कैसे देखते हैं, कैसे पता चलता है क्या क्या इक्विपमेंट से क्या क्या इंस्ट्रूमेंट आप यूज करते हैं जब आप हाई पॉइंट देखते हैं?
जो बेस्ट पार्ट है जो मैं बोलता हूँ, फाइंड द कॉज एंड रिमूव इट. अर्ली डायग्नोसिस एंड प्रॉम्प्ट. You cannot do any occlusal adjustment until unless you find out the culprit occlusal prematurity. And occlusal prematurity exists in various forms. It is not only high point. There is a retrusive occlusal prematurity, protrusive occlusal, excursive prematurity, lateral prematurity, and there is a fremitis, there is a marginal discrepancy, there can be a ridge discrepancy, there is a cusp fossa discrepancy. So there are different types of prematurities. Okay, if you fail to identify it in time, it will proliferate. It will create problems. It can
मतलब
create
हाई
havoc.
पॉइंट के अलावा इन सब चीजों को भी आइडेंटिफाई करना जरूरी है.
If there is a sharpness like that, the teeth are sharp,
Yes.
so it will hurt the tongue, no?
Yes.
If my incisors are sharp, it will hurt the lip also, no?
Yes, yes.
If the teeth are proclined, it will hurt my lips also, no?
Yes, sir.
So if they are sharp, my cusp buccal, it will hurt my cheek also, no? So there is a proper need for a occlusal equilibration.
Okay.
We call it occlusal harmonization, occlusal stabilization. Okay.
Okay, sir.
So there is a need for proper identification of occlusal prematurity. That is why I tend to do the thorough oral examination. Occlusion is a part of oral examination.
Okay.
That is why that is very necessary.
Yes, yes. कैसे आइडेंटिफाई करते हैं सर, आज बताएंगे आप थोड़ा सा?
हाँ, अरे रोहित वो निकाल लेना, मेरा एक ओक्लूजल ट्रे लगा हुआ है, मैडम को बताते हैं कैसे करना होता है.
यस सर, अभी निकाल रहा है.
हाँ, तो ओक्लूजल ट्रे इसमें मैडम बहुत कुछ होता है. ओक्लूजल ट्रे लगाना होता है मैडम, उसमें देयर आर वेरियस थिंग्स. रोहित वो लगा दिया क्या?
अभी लगा रहे हैं सर.
अच्छा,
निकाल दो.
उसको लगा लो और जब लग जाए मेरे को बताना.
ओके सर.
There are many mistakes in occlusal adjustment. So one of the mistake is we don't find the occlusal prematurity, or we fail to recognize the occlusal prematurity, or we tend to complete the treatment without occlusal equilibration. We tend to complete the orthodontic treatment without occlusal stability. Without establishing the occlusal stability, implant will fail. Without giving a prophylactic occlusal adjustment, the RCT will fail. It will fracture.
Okay.
ठीक है ना? So if there is a periodontal problem and tooth is mobile, then there will be excessive pathological migration.
Okay, sir.
Okay, if there is a occlusal prematurities are there. So that is why there is a need that we identify it at the earliest stage.
Okay.
ये लीजिए सर, निकाल दिए.
ओके भाई, इसमें वो वैक्स वार्मर है हमारे, वैक्स ब्लोअर,
हाँ सर है.
वो भी लगा देंगे.
दे रहे हैं सर अभी.
ओके, ये देखिए मैडम, ये देखो ये स्टार्ट फ्रॉम द PMT सेट. ओके.
Okay, sir.
द प्रो मिरर क्विजर. ओके.
Okay.
So this is a blade, special blade for cutting the registration wax. This is bite registration wax. Okay, and this is a normal wax.
Okay, sir.
There is a RT forceps, and we have this Willis forceps.
Okay.
This,
गरम कर दें सर.
अभी रुको. There is a ribbon, red ribbon.
Okay.
There is a blue articulating paper.
Okay.
Yellow articulating paper, white articulating paper. There is a bite registration wax.
Okay.
There is a registration spray, and there is a registration paste.
Okay, sir.
Okay.
Yes.
And there is a calipers, Willis gauze, and this is divider.
Okay, sir.
Okay, to take the vertical dimension.
Okay.
So for various things we have got different registration instruments.
Okay, sir.
So now this is Whitener.
Okay.
So this is also used. This is spray. This Whitener can also be used in spray
Okay,
form.
sir.
Okay, and it can also be used in waste the paste.
Okay, sir.
Okay. So like if I have to take the registration
Okay,
today,
sir.
on my case, so I'll cut the Okay.
Okay.
So this is the station wax. Then एक blower दिखाओ लगाना. Okay. So it is very effective. This blower is very effective.
Okay, sir.
If there is a high point, it comes here.
Okay.
There is a show of the wax. So then we put it in water.
Okay, sir.
So this was the previous one. This is how it comes. So if there is a high point, I study it.
Yes.
Then I make the study model also.
Okay, sir.
Show me the study model.
अभी दे रहे हैं सर, ये लीजिए सर.
ये study model है. And then we study this occlusion in the study model also. We can study the occlusion with the registration wax also.
Okay, sir.
And we can have this registration bite
Okay,
special.
sir.
And we can also study the occlusal point prematurity with the articulating paper.
Okay, sir.
So there we have a different armamentarium for different types of need. ठीक है ना? So with that, if there is a high point in the mouth, then we have got different tools to identify the occlusal prematurity.
Okay, sir.
So whenever patient comes, we start from the extraoral examination. We see the stomatograntic system, TMJ, the facial appearance, the asymmetry, and the expression, facial expression. Then we do the study of the individual arch, lower arch, the upper arch.
Okay, sir.
And then we see the prematurities, the intercuspal point, the retruded cuspal position.
Okay.
And then protrusive occlusal prematurity, and then protrusive occlusal prematurity, then lateral excursive prematurity, and then finally vertical damage.
Okay, sir.
Cusp fossa relationship. If there is a marginal discrepancy, we check. So in a stepwise manner, in a very planned manner, we find out, and with we have a different types of articulating papers with different colors, with the blue, the red, the yellow, for different types of prematurity.
Okay.
Whether it is retrusive or protrusive or lateral, we have different. And then we take the photograph and intraoral camera.
Okay, sir.
So they are different. That is why I am very expert in doing it.
Okay, sir.
And then removal of the prematurity is very easy.